Armamentarium. The newer trend is showing a lot of pictures and asking you to identify the appliance, identifying the instrument. Newer trend is that in NEET. So look carefully. Question number 6. What is this? You want somebody to type in what is this quickly? Nobody knows what this is. Modules, yeah, that is exactly what they also want to know. Modules, these are not modules, okay? If you look carefully, these are called separator elastics. Those are bigger ones than the modules. I'll talk about modules pretty soon. Give me some time. But somebody answered ligature wire. I don't know. I didn't show any wire there. So it looks like module. It's very confusing. The answers can be module, but it is separator elastic. Separator elastic. Then another question, another instrument. What is this instrument? This is a separator elastic plier. Separator elastic plier is a very common question. Why? This is so commonly used in pediatric dentistry also by pediatric dentists. So this can be a question in your pedo as well as ortho. So for all that band and loop and all the space maintainers, whatever you want to put bands on, you need to separate the teeth. So this can be a very common question. Separate elastics or those blue elastics which we use to put. Somebody answered Matthews player. No. Separate. And then question number 8. Any idea? This is there in textbook biology also. Come on. It's a very common, it's a very old tool. Nobody uses these days. This is a separator spring. Separator spring. This is also used if you do not have an elastic or the elastic is not going in. You can use this spring and put between the anything from top and bottom. Teeth will separate. Whether it's elastic or spring, it will separate. Now, next thing is question number 9 is identify this appliance. This is a band remover used to remove bands. Again, used very commonly in pediatrics as well as orthodontics. Band pusher is pushing the band in, is a band pusher. Not a very common question. I've seen it in an Australian board exam. I saw this question, so I just thought I'll just give all the armamentarium here. And then the plastic handle, the band biter, it's called band biter. You ask the patient to bite onto it, the band slowly goes in, band biter. Okay, now comes the plier used to put the module. It's called as Matthews plier. Matthews plier, it's a very common question. Matthews plier is used to put modules, used to put ligatures. That's Matthews plier. Can somebody tell me what this is? If everybody knows this, guys, I'm stopping this here. Distal and cutter, deep Rajan. Distal and cutter. Bracket placer. No, it's a distal and cutter. Dr. Deep Ranjan has said that correctly. This is a distal end cutter to cut the distal end of the wire. You can go all the way back inside and cut it. So that's a distal end cutter. It has a 90-degree angulation so that you can nicely go inside and cut it as a distal end cutter. Question number 14. Anybody wants to guess on this? What is this? Identify this can be a question. It was a question many years before. Recently, I haven't seen. E-chain. Perfect. So that's called elastic chain or E-chain. Now, if they want to confuse you, they can talk about E-chain has something called as continuous, short, and long type of. There are 3 types of E-chain. Continuous means this. After one loop is the next loop is the next loop. Short means there's a small distance between the loops, and the long loop has a long elastic chain has a bigger distance between the loops. That depends upon the interbracket distance. So upper arch normally uses long, lower arch normally uses short, but continuous can be used anywhere. So just want to let you know the varieties of elastic chain also. Okay, now question number 15, somebody wants to give a try. Question number 15, somebody wants to give a try. What is this? Molar tube. Perfect. Now, molar tube, no, bracket, no. Reshma, it's not bracket, it's molar tube. Perfect. But in molar tube, the question can be confusing here, wherein it can be called as a bondable molar tube or a weldable molar tube. Bondable molar tube has this mesh, so that you can bond onto the teeth. Weldable molar tube are welded onto the molar band, which can be the next question. What is the answer? Identify this can be the next question. Anybody wants to give a try on what is this next question? Identify this. Molar band, it is a molar band, but question can be, the choices can be very confusing. These are called as preformed molar bands with molar tubes. Preformed molar bands with molar tubes. So the molar tube, which can be bonded like that or banded like that, there are two types now. Please understand that. Yeah, weldable. Good. Dr. Akshada said that. Weldable to the band or bondable to the teeth. There are two types. Okay. Now, this is the molar bands, preformed molar bands coming in the kit with multiple sizes, because once it's preformed, it won't fit everybody's teeth. So you'll have to have different sizes for different people. Now coming to bracketing quickly, how do you do the bracketing in straightware? You do etching first, dry it off completely, wash it off, dry it off, get the etch a frosty surface, apply the primer, apply the bonding, and then apply composite to the base of the bracket. Apply composite to the base of the bracket. Now, that can be a question. This was a question last year in NB. Identify the supplies. That is a bracket holder. You hold the bracket from the kit using this. And using the holder, you put it onto the teeth. Now, to make you more confusing, there can be a very irritating question that can come. It was there in the Canadian board last year. Before going to that, there's a question number 18. Direct bonded orthodontic stainless steel brackets. Direct bonded orthodontic stainless steel brackets derive retention with the composite because of the mechanical interlock with the mesh at the bracket base. Yeah, that is actually the correct answer. It's just a mechanical interlock with the mesh. There is no chemical interlock. There is no mechanical and chemical interlock. There is no biological interlock. It's just a mechanical interlock. Question number 18. Question number 19 here. That can be a tricky question. It was there in the Canadian board, if I remember correctly, last year. One picture like that and asking a question. Explain a scenario where you fix bracket onto the cast. If you look carefully, the brackets are fixed to the cast. Can you see that? It's fixed to the cast. Why do you fix a bracket to the cast when the patient is sitting there? You're fixing the bracket to the cast. Can somebody here come to the answer on that? Why is a bracket fixed onto the cast? Nobody? It's a little tough. I know it's a little tough. Do not worry. If you don't like that conventional bracketing method, study model, in a way, but that's not the answer exactly. In a way, you take a model, and in the model, you draw the long axis, this, that, and place the bracket in the correct positioning with special glue. After that, you make a vacuum former out of it. Vacuum former out of it. and that vacuum formed one. When you remove the vacuum former, the bracket will be inside the vacuum former. And now what you have to do is put that vacuum former inside the patient's mouth. Etch all the teeth. Apply primer on all the teeth. Apply composite on all the bracket. And put the thing in, light cure the whole arch and remove that plastic tray. All the brackets are in there. This is called indirect bracketing. What we learned earlier is direct bracketing. You fix it. That can cause a lot of bracketing errors. This is called indirect bracketing, where there are no errors because the bracket is done by the lab guys on the exact perfect positioning. All you have to do is put it in, light cure, remove the plastic tray, all the brackets will be there. That's called indirect bracketing. Question number 19. Question number 20. You want somebody to, somebody can talk about this. Question number 20, identify this gadget. Question number 20, identify, I'm almost done. I'm almost done. I promised 5 questions, 5 questions here already. Moons, no, it's not moons exactly, but you're almost there, Dr. BNSH. You're almost there. It's called Boone's gauge. Boone's gauge, Yogita, you got that. Boone's gauge or those gauges used to put the bracket in the right place in direct bracketing. You're talking about direct bracketing here. Boone's gauge is used to find out the positioning. Central incisor 5 mm from the incisal edge, lateral incisor 4.5 mm. So all that minor changes can be adjusted with this Boone's gauge, with this device called as Boone's gauge. So that can be another question that can come. Now, this is the elastic module, the module you're talking about, the color modules you're talking about. Module comes in multiple colors. This was also a question at least 5 years before. I haven't seen this question coming recently, but you never know. They can take, these people putting questions are crazy, guys. They can put anything they want. You should be knowing, yeah? So this is elastic modules there. Elastic, the correct terminology for that is elastomeric ligature. Ligature wire is like 0.010, 0.010 thin ligature wire used to tie the wire to the bracket. We are talking about elastomeric ligature. So this is the elastomeric ligature. That is the Matthews plier. And you take it with this and put it into this. That's placed like this. Guys, today I had a patient. Doctor, I'm not wearing my uniform for last 1 year. It's online classes. But I wish I get module colors in my uniform color, please. So put alternate blue and black or dark blue or whatever. People are crazy, guys, but you should be knowing about all this. And there is a new stuff called glow in the dark modules also available. Glow in the dark is like you put these modules, ask the patient to go home at night, 12 a.m. at night. Switch off all the lights in the room and come in front of the mirror. It'll look like everything will glow like this. Yeah, there's a glow in the, all sorts of innovations going on in this one concept called elastic